1 out of 9 babies are born prematurely each year in the United States. I became very interested in the prematurity topic after I gave birth to my first daughter, Layla. She was born 4 weeks prematurely and spent 2 weeks in the NICU, also known as the Neonatal Intensive Care Unit. I know right now you're wondering why you should know about the prematurity topic. I feel that everybody should know about the prematurity topic since any woman can give birth to a premature baby. A few things that I think that you guys should know is why do women give birth prematurely, the health defects of a prematurely born baby, and the NICU environment the prematurely babies spend in. Why am I giving birth to my baby so early? This is a question that many women ask themselves when they go into premature labor. Let me start by saying that there's no specific reason that a woman may give birth prematurely. Most common reasons are multiple births. If a woman's giving birth to more than one baby, there's less room inside of the uterus for the babies to survive. Also, there's less nutrients that are going to both the babies, so the doctor may suggest to remove the babies earlier to help save the babies. Also, if a mother has health defects such as cancer or infection, the doctor may suggest also to take the babies out so that it helps save the mother and the baby. Did you know that race actually has an effect on premature babies? 50% of African American women have a 50% higher chance of giving birth to a prematurely born baby than any other race. A woman may do everything right throughout her pregnancy up until preterm labor, but still may have a baby born with your birth defects. There's many birth defects that a baby may carry when they're born prematurely. Most commonly, underdeveloped lungs. A baby's lungs start to form at 24 weeks and continue to develop up until 36 or more weeks. And a baby's undeveloped lungs may have a problem such as bronchopulmonary dysplasia, BPD. What this is when the baby's lungs start to vanish. They start to slowly disintegrate due to machines and stuff being placed onto the lungs to help develop them. Also, respiratory distress syndrome. This is a very broad word, but it's more geared toward a life-term sickness. This can be such as asthma is the most common respiratory distress. Intraventricular hemorrhaging. This happens to babies born 24 to 26 gestational age. This is when the baby's brain bleeds. A baby's brain is underdeveloped and thin as paper, so the blood is almost thicker than the brain and the brain starts to hemorrhage. Giving birth to a premature baby is very scary for mothers. It's a very good thing that we have such amazing NICU nurses. The NICU nurses help give the mother peace of mind knowing that their baby is in good hands. Also, they help give the baby a comfortable environment. They dim the lights and use subtle voices to not stress the babies. Premature babies get very stressed out very easily since they're taken out of their environment so early. Also, once a premature baby enters the NICU environment, they're placed onto 3 different monitors. They are placed onto a cardiac monitor, a respiratory monitor, and a pulse oximeter. The cardiac monitor monitors their heart, makes sure that they don't have any bradycardias, which that is when the heart drops below a certain beat. The respiratory monitor monitors how many respiratory breathings they're actually doing per minute per second. And the pulse oximeter helps maintain their pulses and keeps track of how many pulse beats they're actually having. With these ideas in mind, which I felt that everybody should know, just a few thoughts, I would also like to say that everybody should know that a premature baby does not necessarily mean that they may have issues for the rest of their life. A premature baby may also grow up to be perfectly healthy and live a normal life. For all you know, the person sitting next to you may have been a premature baby. That's it. Stop.